Greetings. Let's take a moment and discuss the NCOPE competency forms for attainment of orthotic and/or prosthetic competencies. For demonstration purposes, we've already signed in as a mentor to evaluate our hypothetical resident, Rachel resident. At the moment, we are using the prosthetic competency forms. For the prosthetic competency forms, you'll be able to complete and evaluate competency for all 5 required competencies. The orthotic form will explicitly list the 7 required competencies. Please select the intervention that you wish to assess competency for. In this case, we will select transtibial. Once we click the Next button, you'll be prompted to identify the name of the facility where the residency is taking place. The reason for this is many organizations have residents rotate through multiple physical locations. So in this case, we can identify a hypothetical clinic. Let's go ahead and say Hanger Clinic, located in Oak Park, Illinois. Please note, they don't actually have a clinic located in Oak Park, Illinois. Other fields will automatically be populated. Let's go ahead and click our Next button, and the mentor information will be automatically populated for you. If you find this information is incorrect, you'll need to edit your profile by clicking your name inside of NCOPE Tracker. But in my case, everything looks correct. You'll identify which quarter that the competency form is being completed. Competency can be attained at any point during the residency. Please note, quarters 5 and 6 are normally only used for dual discipline residencies. If your resident is in their second discipline, please don't use quarters 5, 6, 7, or 8. The residency restarts at quarter 1 once the second discipline begins. In order to evaluate competency, there are 4 steps that are recognized within NCOPE Tracker: beginner, developing, advancing, and competent. Please note that there are additional levels of ability that are also possible for individuals to attain. Those include proficient and mastery, and those levels of ability are typical to the residency directors and mentors themselves. Remember, the resident must achieve competence or a ranking of competent for all aspects of care for the intervention prior to the conclusion of the residency. For the purpose of this form, competence is defined as having sufficient knowledge, judgment, and skill to provide appropriate treatment interventions. It may not be at a level of ability that a highly experienced practitioner may offer. In order to deem the resident competent, you must select competent for each one of the respective areas of the practice framework: assess, formulate, implement, follow-up, and practice management. Once we select competent for all of the boxes, you'll notice that an additional pop-up window becomes visible. In order to be deemed competent, you must also demonstrate the core competencies defined within the ABC residency standards, including ethical, patient-centered care, safety to self and others, awareness of humanity and dignity of all patients, and the ability to impart knowledge and instill confidence when providing patient care. If all 5 fields are set to competent and all 4 tick boxes are checked, we will select the Next button. You'll have the opportunity to provide additional feedback to the resident if you would like. In this case, we're going to select No, as they've already achieved competence. Select Next. At the very bottom of this form, you'll have the ability to submit an attestation. You need to select Yes, that you are in fact attesting that this individual has achieved competence. Once we click the Next button, you'll see a thank you notification. And this form will be provided not only to the resident and mentor deeming the individual competent, but also the NCOPE staff, so that it can be appended to the resident's permanent records. Thank you for your time.